Sawadika. Today I'm at the World Health Organization Thailand and we're gonna be having an interview regarding breast cancer. So please introduce yourself.
Sawadika. I'm Jos van der Laar. I'm the WHO representative to Thailand.
So I'm having a breast cancer raise awareness and fundraising campaign. Therefore, it is my pleasure to be having this interview with you.
Certainly, breast cancer is a major problem worldwide. Every year, about 670,000 women die of breast cancer. And in about 85% of the countries, it is the most common cause of cancer. So globally, it is a major problem. And it's particularly tragic because many of these cancers could be early detected and treated. So many of the deaths that happen every year could actually be prevented. So breast cancer is a major issue.
And how serious is this problem globally, and who are suffering most from this?
Breast cancer, globally we see breast cancer in all countries. And so it are particularly women, as they grow older, they're more affected. But what we start to see also is that women get affected earlier in life.
Yes.
So what is important is that we have early detection, that basically when women develop breast cancer, that the diagnosis is made as soon as possible, because then the chances of survival and the chances of good treatment are much, much higher. So that is basically the overall situation globally. And in all countries this happens. In all countries breast cancer is prevalent. In 85% of the countries it's even the most common cause of cancers among women. And in Thailand we see a similar picture. In Thailand about 23% of all cancers in women are breast cancers. But luckily in Thailand, around 90% of the women survive. Again, indicating how important it is to detect it early and treat early. So in Thailand, there is also a program called Cancer Everywhere, which allows women, once they are detected as having cancer, breast cancer, that they can go anywhere in the country to get treatment, which is a fantastic option for them to get treated.
That's amazing.
Indeed, yes. What we globally also see is that in countries with a high development index, that means countries with higher education or better education, better qualities of life, higher life expectancy. So in these countries, the proportion of cancers diagnosed is actually higher than in countries with low HDI. And that is because there is more possibility to diagnose. Countries with less development don't have all the possibilities to diagnose. And when it comes to deaths, we see the opposite. In countries with a high development index, fewer women die, but in poorer countries, more women die. And again, that is related to the quality of care, the care available, and so on to these women. So we see a lot of inequities between countries, depending on how well the country is developed.
So what are the strategies that the World Health Organization are supporting countries to integrate their breast cancer into their health system, especially in low-income and middle-income countries?
Yes, so we must make sure that we invest in awareness raising like you're doing, so that women are aware that they may be at risk for breast cancer. And of course, they need to look at their lifestyle. How healthy lifestyle also means less breast cancer. But also it is important that we screen women early. So that means mammograms for women mainly between 50 and 70. But also every clinical exam should actually include a breast check. And of course, women should check their breasts themselves. As soon as they feel something, seek for care. So that's all very important. Early detection, because early detection means much higher chances of treatment, of successful treatment, of survival. So that is very, very important. At the same time, of course, we need to work on treatment itself. Access. Women need to have access to treatment once they are diagnosed with cancer. Treatment that is of high standards, and also that there are no barriers to seek this treatment. Transport may be an issue. Sometimes finances are an issue. Sometimes cultural things are an issue, that people sometimes are ashamed of coming out and seeking help for this. So we must work on improving the access to care. And then we must also make sure that the communities, the people around women are supportive. So, because getting a diagnosis of cancer is a shock.
Yes.
And so the family need to be supportive, the friends, the community needs to be supportive, and we need to work at that as well. So it is important to bring all these things together so that women are aware of their risks, regularly screened, are treated quickly if needed, and have a supportive environment.
Can you please provide updates on any global initiative, collaboration that focuses on breast cancer?
Sure. One important global initiative is the Global Breast Cancer Initiative. And that initiative actually looks at how can we find better financing for everything related to breast cancer diagnosis and treatment, and how can we also improve research and the treatments themselves. And the goal is to reduce deaths because of breast cancer by 2.5% per year. So that would mean a reduction of about 2.5 million deaths between 2020 and 2040. So under that umbrella, a lot of work is happening around awareness raising, women needing to be aware that their lifestyles count, but also be aware of their family history, for example. And therefore, when they have any doubt that they are looking for care, we need to invest in screening, better screening opportunities, so that if there is a growth in the breast, that is early picked up and early diagnosed, and if needed, treated as well. So good treatment protocols are also very important, standardized treatment protocols. And all these three things around awareness, around diagnosis, and around treatment are things that this global initiative is very strongly focusing on, with the goal of reducing deaths due to breast cancer by 2.5 per year.
And how is the World Health Organization are supporting countries that would implement breast cancer care into their national healthcare system, and ensuring them that the information, the guidelines that they are receiving are based on the latest evidence?
So we work with countries developing the national plans, because every country needs to have a plan on how do they want to deal with cancer. How do they want to improve their screening facilities? How do they want to provide treatment to patients, and so on. So that is something we work on national plans. We work with government also on, for example, on guidelines around protocols, treatment protocols, so that the treatment given to patients is up to international standards. And this is something we work with governments to adjust that on a regular basis, feeding back from what the research has told us. So we try to ensure that treatment protocols, the treatment that doctors are actually giving to patients in a given country, that is based on the latest research. And then also we need to continue to work with them on training people. Training not just on treatment, but also on diagnosis. The health workers who do mammograms, the health workers who work with women, they need to be properly trained so that when they examine women, that they know how to examine for breast cancer in particular, to raise the alarm in case something needed or there's a risk that the woman may have breast cancer.
Can you please also share some of the best practices in order to tackle breast cancer?
Certainly, there are many best practices, and it's important that people remember them. I think maybe the most important best practice that every woman can and should do is self-examination. When taking a shower, when getting dressed, to self-examine her breasts, and that if she thinks she feels something, then look for help. Go to a health facility, go to a doctor, and basically tell the health provider, I think I felt something. And so that then it can be further examined. That's the first step, and that's something that certainly is very, very important for every woman, that everybody can do on a daily basis, basically. So that's the first step. But then maybe from a systems point of view, from what the health system needs to do, is it has to have systems in place to raise awareness. So women need to be aware of their risks.
Yes.
And the risks are higher if you live an unhealthy lifestyle. Unhealthy lifestyle, for example, alcohol use, lack of physical activity, unhealthy foods, and so on. So all these can contribute to the development of breast cancer. So we need to keep that in mind, that lifestyle is important. Also, family history is very, very important.
Yes.
So people need to understand that, and we need to do awareness campaigns like you are doing, so that people can hear this, that they can examine themselves, that they need to think, am I at a higher risk because maybe my lifestyle is not so healthy?
Yes.
Do I have breast cancer in the family? Did my mother have breast cancer? Do I have a sister who has breast cancer? And so on. Does it run in the family? That's an increased risk. But also lifestyle. How healthy am I living? How healthy is my food? Am I using alcohol? These things are potentially contributing to a high risk of breast cancer. And so I think it's important for everybody to keep that in mind, that not every woman is at the same risk. And particularly if you are at high risk, to regularly check your own breasts and also ask your healthcare provider. Please, when you go even if you go to a doctor for, say, you have a cough or you have headaches, let the doctor check the breasts also, just in case there is something there that otherwise would have been missed. Regular mammograms is another thing that's important, particularly for women between 50 and 70 or so. On a regular basis, maybe once or twice, once a year, every 2 years, to pick it up in case otherwise it would be missed. Early diagnosis, really, really important, because breast cancer evolves, and the longer you wait, the lower the chance of survival.
Yes.
Luckily in Thailand we have like 90% survival rates, but that is because people are diagnosed very early and get good treatment. But if you wait, then your chances of survival go down. So it's really important to have early diagnosis, early treatment. That is really, really important.
And lastly, Dr. Jose, is there any thoughts or key message or important notes that you would like to share to the people that are listening?
Certainly. I think the key message is breast cancer can be prevented by good lifestyles, but also breast cancer doesn't need to be deadly. It can be treated. And for that, early screening, early diagnosis is very important. And every woman can and must do her own part by examining her own breasts regularly, but also asking her health provider to do the same thing at every possible occasion.
All right. Thank you very much, Dr. Jose, for the amazing information and interview today. I hope that all of my listeners will be more aware about their health and got the information they needed. So thank you very much for today.
Thank you very much. Thank you. It has been a pleasure, and I hope everybody will take to heart the advice that you're giving,
yes,
and that we can prevent more breast cancers in the future. Thank you.